Now, in terms of some of these opportunities, we have to think about so you think about hospitals, you look at primary care. There's home and community care as well. You have public health. There's indigenous health organizations, northern remote regions, and we also need to look at mental health as well, which is very big in Canada. You can think about digital health and virtual care. We have clinic research. You have healthcare innovation as well. And those are some of the broad areas that we can consider when we look at the what to do if it is that you are looking at alternative employment opportunities in healthcare before even going through licensure. So here when we look at the labor market itself. So our healthcare shortages projected to exceed 200,000 healthcare workers, and this is across all of the sectors, so across nursing, across medicine, across pharmacy, medical laboratory technologies. When you look at the projections coming from the different regulatory colleges, all of this add up to approximately 200,000 healthcare workers in terms of shortages. When you look at the roles in terms that you have in public health, these are also expanding. And so the traditional roles that you have, they're still there, but you also have a lot of emerging roles as well. And these are not just entry-level roles, but also higher-level roles that require the leadership skills that as an IEHP you will have and are valued for these roles. Now, when we look at Indeed, and this is from Canada, just for Canada itself, this is the trend that they have been seeing. So when you look at employment, for example, in the populated areas, you would realize that the all-time, in terms of the amount of persons getting employed or the amount of job opportunities that you find within these areas, they tend to be lower. But when you look at other metropolitans, so you have the big cities, so these are what is happening in the larger cities, low employment rate, low opportunities that are available year over year. This graph that you're seeing here runs from 2021 to 2025, all right? So let's minus 15% in terms of that employment turnover for our IEHPs within that area. So in terms of the other metropolitan areas, for example, those smaller metropolitan areas, you would realize that you have a kind of a positive trend there. So while employment rate is lowered somewhat, it is still greater in terms of the number of persons or number of opportunities that you will have in these areas compared to what you may see in the three largest cities in Canada. Now, if it is that you expand to the non-urban areas, so we look at the rural areas, you look at indigenous health, you will realize here that you have a five-fold increase in the number of opportunities that are available out there. And so this is not just things that we're saying, okay, go to rural areas, look at this part, or go to this city, go to these smaller communities because the opportunities are out there. But the evidence is also there to support that you do have these opportunities available in these areas. Now, as IEHPs, you have a lot of transferable skills, and these are valued by our employers. Why is it that these are valued by employers? So you look at assessment, your ability to assess patient in terms of where they are. You look at the presenting problem, for example. You are able to document all of these things. You may be coming from, say, a resource-stricken area as a physician. And so you have developed over time very innovative ways to basically get things done as it pertains to delivering healthcare for these individuals. And so all of these experience with these global health conditions as well that you might not necessarily see in Canada. So you will have all of these reports because the diagnostics is there, and you have a lot of evidence-based medicine being practiced in Canada. And so you have all of these systems where all this information is reported into. But is that the full scope of the problem that you're seeing out there? Not necessarily, but with this global experience that you come with as an internationally trained physician, for example, you are exposed to all of this that you may be seeing. You may be treating empirically, for example, but when you look at, say, the Canadian system, you're going towards evidence based medicine, all right? And that is valued. Your experience that comes, you tie that into this evidence based medicine framework, and that becomes very valuable here in terms of how you can contribute to the delivery of care within the Canadian context. Cultural and linguistic diversity as well celebrated. So Canada is a multicultural society, and that we need to embrace, you understand. So English, French, those are the two languages that are spoken here in Canada. Have that understanding that your language as well that you speak, if it is that you speak Hindi, you speak Urdu, you speak Igbo, or Spanish, or whatever other languages you speak. You have different communities within Canada as well, where you may have an abundance of these native speakers of the language that will also require healthcare. And in terms of offering culturally appropriate healthcare, you become very valued in these settings as well for your mother tongue that is not necessarily English or French. Resilience and adaptability. So you look at the local area where you may have been practicing before coming into Canada. What exactly it is that you were doing prior to coming into Canada? What was that resource setting look like in terms of the delivery of healthcare? And so over time, you have developed these skills to function in the face of adversity and are able to adapt to even these harsh conditions as it pertains to practice. And so when you come into Canada, you're going into these different areas. You already have these experience and are able to apply all of what you have learned based on the experience that you have within your setting. Team collaboration and communication, you know how to basically communicate with persons to get things done. You know how to lead teams. And so coming in, you can also think about those leadership skills that you have honed over the years of practice in healthcare and how you can transfer those skills into leading teams here in Canada, managing healthcare here in Canada, outside of licensed role. Now, are you an international medical graduate? You can look at some of the roles, such as clinical assistant, for example, in Ontario. Clinical assistant is a non-licensed role. And so if it is that you want to say engage in healthcare, you don't want to leave the profession, you're not yet licensed, you have options there for you. Okay. So what is it that prepare you for some of these roles? So the clinical assistant, the health program assistant, the research assistant role, patient flow coordinator, virtual care support, all of these, healthcare educator, public health outreach worker. Also look at the community health work and the quality improvement assistant. You start thinking about those transferable skills that you have as an international medical graduate. What exactly are these transferable skills? You can look at clinical reasoning. You have this ability already. You have been doing it. So you were trained for one, you underwent internship, and you may have been practicing for a number of years. And so you're able to reason on a clinical level. Documentation as well. So the different documentation format that you may use within your specific domain. All right. So as a nurse, collecting all of this information from the patient, social history, collecting family history, how does that impact or how is this information used to deliver care to the patient? As a medical doctor, you're collecting all of this information about the patient. You're looking at their medical history, you're looking at drug history, all of these things. And so over time, you have developed this history of, or these skills as it pertains to documenting information about patient and using this information to deliver care. You're able to do risk assessment as well. And so again, you can look at transferring all of this into alternative roles that are available and are out there within the system. So we look at the complex documentation and charting, interdisciplinary teamwork, public health awareness as well. And a lot of what from the applications that we see coming from time to time, a lot of our international medical graduates, they may have practiced in public health, or they're also trained in public health as a secondary or continuing education. And so a lot of them are certified. They may have a Master of Science in Public Health. And so here it is, you were also prepared, not just by reason of practice, but you were also prepared for these roles through a formal education system. And so here you have technical skills that you can transfer into these non-licensed roles in public health, as well as the practice skills that you may have gained as a result of practicing as an international medical graduate. You have the ability to research as well, and a lot of you come with publications. So the nurses, the pharmacists, the doctors, the dentists, you have been in research for however many years. You have all of these publications under your belt, and so you may also pursue roles that are related to research or healthcare research as a whole. Now, if it is that you are looking at alternative roles, you don't have to always think about licensure. Clinical research assistants, research coordinator, you could look at study monitor, ethics, and REB coordinators. So all of those are different roles that as international medical graduates, you can consider within healthcare that do not require licensure. You can also think about quality and patient safety. And for these, you can look at quality improvement specialists. And if it is that you think about areas such as the pharmaceutical industry, for the pharmaceutical industry, these are persons that are always valued, always needed for practice. Patient safety coordinator, utilization analyst, incident review analyst. So what exactly is happening in this space? And so as an individual, as an IEHP in Canada, you have access to quite of these that you can engage in. Digital health informatics as well. Why exactly it is that you fit into this role as an international medical graduate? You have higher baseline understanding of infectious disease, for example. And so you can look at how we have various ways, of course, where you can use this in the Canadian context. So you can look at epidemiology, what exactly is happening within this framework. Public health program officer does not require a license. The disease investigator, you don't require a license for this. All right. Just need to have an understanding of digital health, for example, how it is administered here in Canada. And so this ties in now to the clinical informatics role. You have electronic health record trainer. You in Canada we use Epic, we use Cerner a lot. Okay, how exactly it is that all of these roles will fit into this framework? All right, so I'm seeing a question here. I'm going to get licensed after 1 month. Should I look for non-clinical roles because I have landed in Canada? Now, if it is that you're going to get licensed in a month and you're able to wait, I'm not saying you should go and look for a non-licensed role. All right. But for those persons who are not able to pursue licensure, those persons who want to do something before they get licensed, you don't know exactly what it is that you can do. I'm saying to you that there are a lot of options out there for you. All right. Thank you for that question, Kiran. Now you can look at community health and primary care support role as well. And in this case, you have things such as the patient navigator, you have chronic disease education specialist, refugee health coordinator. And if you go to organizations in that have or deal with a lot of newcomers, for example, and offer health care, you will find a lot of these roles exist within these organizations where you can meaningfully interact in the delivery of healthcare and still maintain your connection to the healthcare system as a whole. Okay? Now, if it is that you're internationally educated dentist, for example, what can you do? And you have quite a bit of options in terms of what you can do as an internationally trained dentist. You have some roles here, for example, dental assistant, treatment coordinator. You can look at sterilization technician. You could also look at infectious control lead. You understand these principles as well. You've been doing all of this in your practice for a number of years. And so these are additional options that are out there for you. Community oral health educator, for example. You can also look at that. School dental screening program worker. So you may go to George Brown, for example, apply for roles within their dental school. Dental product educator. So even the drug companies or the companies that sell all of these medical devices and personal care devices that support the maintenance of proper oral health or oral hygiene. So they oftentimes need demonstrators. You can look at this as a way of you engaging in the system. So you have opportunities or options out there for you. What is it that prepares you for this role? You have all of that manual dexterity and fine motor skills that prepare you for these roles as an internationally trained dentist. So this is what you have been doing all the time that you have been working in your home country. Infection prevention. So every time you take up an instrument to look at someone's oral cavity, to look in someone's mouth, you're thinking, how is it that I prevent infection? How is it that I not transfer or use a contaminated instrument? Okay, and so here you understand all of these sterilization principles. You all also understand oral health assessment, behavior management as well. So some persons, they may have phobia of going to the dentist. How exactly it is that you navigate those for the patient who has phobia of going to the dentist. And so here you have quite a bit of roles that you can think about, that you can engage persons in. And so you can start looking for some of these roles within the healthcare sector. And again, not just focusing within the major city centers, but moving away into those smaller areas where these are critical needs that you need to respond to within the healthcare system. Internationally educated nurses, you can think about the research assistant, the health coach, public health worker, and the list goes on. You have quite a bit of them that are listed here on screen. Now, you can think in terms of how can I solve a problem that may be within the system, all right? Do you need patient assessment for a worker that knows how to do patient assessment within a rural community? Do you need someone that needs to help with the care planning in a long-term care facility? Someone that understands how to document all of this patient information that is being given by the patient, how to put this in a format that is usable as well. As a nurse, you understand the infection control principles, you understand medication safety, you have knowledge of these as well. You also understand trauma-informed communication. And so as a result, you are well poised for a lot of these non-licensed role as a nurse in healthcare And so you can start thinking about clinical extern, patient flow assistant in terms of some of those roles. Look at the unit clerk role as well. You don't require a license for these. And as a result of your understanding of patient care, you're able to enhance coordination within these roles. Home care community coordinator, patient navigator, you can look at discharge planning assistant. And why is it that you fit for these roles as an internationally educated nurse? You're already thinking in terms of care and continuity. And as a result, you become well poised for these roles. Community health and public health. So health promotion worker, for example, you could look at the community support worker, refugee or newcomer health worker, mental health outreach worker. And these are some of the roles that you can look at as an internationally educated nurse. You have an understanding of health education and counseling. And as a result of this understanding, again, you're well poised for this role. Let's look at the midwives. So you have some roles listed here. Now, in terms of the midwife, you can start thinking about the perinatal educator, for example. Doula program support. So all of those persons who think about even emotional support for pregnant mothers. You don't need a license for this. Prenatal care, postnatal care. You don't need a license for these roles. And so you can think about those transferable skills that you have in terms of maternal and child health. Uh, Look at emergency decision making as well. So in the process of delivery, what are some of those support that the registered midwife may need within that setting? And so it becomes crucial here. You can start thinking about those roles where the role does not exist, where the role is needed within the specific setting. You can also think, how is it that I can create this role? How is it that I can support, say, the licensed professional that is within this role, offering this service within the specific context where the service is needed, but it is not delivered because the individual that has the expertise to deliver the service is not available. So we look at lactation consultant. This is also non-licensed role. You have pathways that exist for this as well. Childbirth educator. So I can go on and I can list and list and list a lot of roles that you can look at for the various professions that you can engage in from time to time. Medical laboratory technologist, research lab assistant, very useful there. Now, if it is that you're thinking about research lab assistant, the diagnostic equipment support, you can also think about biotech quality assurance technician or quality analyst. You can look at clinical trial support as well. Specimen processor. For these, you don't need a license to practice within these areas. All right. And so, again, you have all of these experiences. Do not allow these experiences to go to waste as an internationally trained professional coming into Canada. So, in terms of transferable skills, start thinking about laboratory safety. You already have this skill. You already know how to handle samples. You have analytical accuracy working in your home country as a laboratory technician, a trained laboratory technician in a licensed role. The quality assurance aspect of it as well. You already have that skill and can also transfer that to non-licensed roles here in Canada. And data management as well goes without saying in terms of that transferable skill that is very much valuable for your specific role. International pharmacy graduate, you can think about the pharmacy assistant role. There are drug safety roles as well, and you can also think about pharmacovigilance. This is very huge when you look at hubs where you have a lot of drug manufacturing taking place, where you have a lot of drug research and development taking place as well. Pharmacovigilance becomes very crucial where you have these major drug houses, hosts that are monitoring the impact of these medications on the populations that they serve. And so in terms of those skills that you have, medication knowledge, you can think about the safety and quality focus as well. You can look at drug use evaluation. And in terms of drug use evaluation, you may go into the hospital as well and think about the roles that you can play within these institutions that does not require you to get a license. Now, patient counseling here, you can transfer these skills into non-licensed role as well. So what kind of information can you disseminate to patient? So it requires a licensed pharmacist, for example, to counsel a patient on their medication, okay? But you can educate patient about disease conditions. You can educate patient about when to seek advice, who to seek advice from, and all of these. Public health as well. You have a lot of pharmacists that are trained in public health. And so there are other roles that you can engage in. Problem solving skills, very adept there. And so, or as IEHPs coming into Canada, you don't just need to think about those licensed roles. You can also think about the myriad of alternative healthcare roles that are accessible out there to you. Dietitians, nutritionists, again, a number of roles, and you also have quite a bit of transferable skills that you can think about. So clinical nutrition assessment, you have that skill already. You've developed it from practicing. Chronic disease management, so the diabetes, the hypertension, all of those diseases as well, that chronic diseases coupled with lifestyle diseases that are plaguing our population. You have these transferable skills and can, of course, navigate or help in terms of that navigation within the healthcare system. Food safety and sanitation is another area where you have those skills honed already, where you can make an impact. You can also look at health education and behavior change for the population. So what information is communicated out there through the most common or accessible media for our population? And how is it that you can make an impact as a dietitian, internationally trained, or as a nutritionist, internationally trained, coming into Canada? Where can you focus your efforts? And so you have those roles as the nutrition educator. In terms of public health, you can look at the public health nutrition assistant, food and nutrition industry roles as well. So the industries that are providing the food, that is manufacturing the food, processing them. Look at quality assurance technician and why exactly it is that you fit into these roles. So you understand ingredients, you understand safety, you understand product claims as well. Okay. And so having all of these knowledge, you can combine that with the consumer health information that you have and function fully within these roles and be, of course, engaged within the system itself without a license as a nutritionist or as a dietitian. You can also think about research and academia as well, dietary data collector. You have a research assistant, nutritionist, and health promotion research worker. And again, I can go on and on in terms of the different roles that you can engage in as a dietitian or a nutritionist coming into Canada. Now, you can also look at, for those persons who are in allied health and wellness, maybe the physiotherapist, for example, rehab assistant, you don't need a license for that, exercise therapy assistant, personal coach as well, accessibility assessor, look at ergonometrics as well in terms of, so you can look at things in terms of workplace safety. Look at how workplaces are designed. You can make recommendations within these areas. You can develop training programs or educational programs within these areas. So those are areas that you have there that you can also tap into. mobility support workers. And for this, we have a lot of rehab institutes right across Canada, or dedicated rehab clinics for persons who need this kind of healthcare service. You don't need to have a license to function within these roles. You already have these transferable skills. So the functional assessment, the rehab planning, you have assistive device knowledge as well. And when we look at assistive device as well, you can also look at the organizations as well that create these devices. So if it is that you want to go into, say, the industry, or approach from the industrial level, you could think about the companies that manufacture these devices, and maybe you want to work as a medical science liaison, for example, educating persons on the use of these devices, and not just the patient using them, but also the practitioners that are recommending or prescribing these devices. You understand goal setting, and not just goal setting, but structured goal setting in terms of getting persons from dormant state to functional state, patient engagement, and how to engage individuals. And so you have quite a bit of transferable skills that you can use within these areas. Now, I keep talking about public health a lot, and that is because for public health, you will have a lot of persons that are trained in public health, that have practiced in healthcare. So our doctors, they may have gone and they got their master's in public health. Myself, I went and I got a Master of Science in Public Health. Those are areas where you don't just have transferable skills developed from your practice as a physician, or from your practice as a nurse or as a pharmacist, but you're also trained in the area. And so now you come with both technical knowledge within the area and also transferable skills from your practice as an internationally educated healthcare professional. All right. And so here you can think about roles such as the community outreach worker, chronic disease programs as well. What does your role look like within these programs? Think about senior and youth health. And for senior health, you look at the long-term care facilities. You could look at home care as well. For the youth, you start thinking about the schools. What exactly are those programs that are available within the schools? And what are the parameters of these programs, and look at how exactly these tie into population health as a whole. Look at the health promotion programs that are available out there. Recently, Canada lost one of our disease eradication status. So for measles, for example, if you have been following the news, you would realize that we cannot say anymore that it is eradicated here because of the number of cases that we have been having right across the country. So some imported, and then there's quite a bit of local spread as well. How is it that you can make an impact there with your knowledge of disease control, with your knowledge of public health, health promotion as a whole? How is it that you can make an impact? What exactly is that role that you can take up there that does not require you to get a license? And I'll tell you for sure, most of those roles that you will find in public health as a whole are non-licensed roles. And so in terms of those skills, so you have the community support roles, settlement health programs. For a lot of these, you will find them within the community-based organizations, outreach and navigation support workers, wellness program, case support roles, and the list goes on. Now, in terms of the different roles, when you look at community health itself, those are some of the roles that you can think about when you want to think about what exactly does it mean to work in community health. So these are some roles that you're seeing, and I've just clustered them here for you because when you look globally, or when you look generally across Canada, you have these defined roles out there. You may not be understanding what exactly it is they are or what they mean, okay? And so what we're doing here is to basically define these for you. You may not have had them in your country of origin, so you may have a Ministry of Health, for example, that governs the delivery of healthcare within the country. And then all you know is the physician, you know the pharmacist, you know the nurse, and all of these individuals work within, say, a hospital, they work within a clinic, and then you have that general hub, which basically governs the delivery of healthcare within the country. But within Canada, it's a little bit more complex, and some of the system is very fragmented. And so there is quite a bit of difficulty in terms of understanding the different roles that you can take up. And so I've just clustered these here just to kind of demystify some of the fragmentation that you may be seeing out there. All right. So you look into things such as digital health, for example, which you will find in my third cluster here. And for this, you can think about digital care, so virtual care support, electronic health record system, so training persons to use common systems that we have here in Canada, such as the Cerner or Epic, that you will often or from time to time come across in healthcare. Telehealth coordinator, health data support worker, digital navigation specialist. So all of these are roles that you can take up that you do not necessarily require a license to get into these roles. Now let's look at some of those roles that also are high impact or high value role. So sometimes you might think, okay, if I don't get licensed and I'm going to take up this role, I may be restricted to minimum wage. This is not the case. Some of these roles are also quite high paying roles, especially when you look at the pharma industry, for example. If you look at quality and safety, for example, or even within government, if you look at quality and safety role, all of these roles are very high value role and are also roles that remunerate you based on your skills and qualifications. So the quality improvement assistant, you don't need a license for that. Accreditation support as well, that will support the development of policies that are proposed to the regulatory bodies or governing bodies to get things accredited, to get programs accredited, to get approval as well or license for devices, for drugs, all of those. So you can provide support or administrative support within those roles and still integrate within the system and still be paid well for these roles that you're functioning in. Infectious control support as well. Again, we all understand these measures. Audit support, so we understand disease conditions. We understand all of these, so we understand all of the expectations or outcomes that you're supposed to be getting if it is that you're having a certain input. And so it is okay for you to start looking into these other roles as well, where you can support the healthcare system and not just free up the licensed professionals from some of these roles to go and deliver direct healthcare where you may not be licensed, okay, but also provide generate employment or income to support yourself and your family here. In cluster 5, we can look at research and academia. And here you have the research assistant, you have study coordinator, you have teaching support individuals, knowledge translation assistant, and the health science tutors. And for these, I'll say if it is that you have background within this area, you are wondering how is it that you can get into these organizations or institutions, feel free to reach out. Again, we speak about the broker. So those organizations that you have access to, the community-based organizations, contact them. The mentorship programs, for example, Ontario Health, reach out to them. You understand they have all of these programs that support your integration. Say to them, okay, I'm noticing there's this research facility within my community. I would like to engage with them. Do you have a connection so that you can make a recommendation or you can connect me with this organization? All right. And from those roles, not just looking at volunteering, You might find there are additional roles within the organization that you can actually fill because you have those skill set to fill these roles within the specific organization. You can also look at cluster 6 here, where we can talk about mental health and social care. And for this, you have the peer support roles as well that you will find within these areas: addiction support worker, housing health liaison, crisis responder, community and mental health assistant. And some of these are skills that you have developed from previous engagement that you have within the system, and are able to provide guidance. You're able to provide adequate information or function fully because you already have these transferable skills for these specific roles. Within cluster 7, we can also look at the pharma industry. And for this one, you can look at things such as pharmacovigilance support, medical affairs assistance. And within the medical affairs group, you have a number of roles there that are non-licensed. For this, again, if it is that you're unsure, you can also go and look them up. Feel free to reach out to us as well. We'll be happy to provide some guidance in terms of some of those different roles that you can actually take up within medical affairs that may align with your skill set and your background. Look at sales support health devices. So marketing these devices or even promoting drugs, the medical science liaison. So those persons who go and brief the other healthcare practitioners in terms of how these medications are used. Think about those roles as well. I'll say to you, do not be close to rural and remote opportunities. So if you have some examples here in terms of hospitals or health clinics that you may find within these areas that you can engage in. And so take up these opportunity or be open to the opportunities of moving out of the populated or densely populated area into some of these smaller areas where you have more integration with indigenous health, for example, and you have a lot of these employers are also open to employing internationally educated healthcare professionals. You also have the ability to negotiate as well within these settings. And so there you have incentives to move to these areas, remain connected to healthcare, and not just say, okay, I cannot, so let me leave the profession. And so as we wrap up, I would like to look at your job search strategy. Look at the IEHP friendly employers so you can scan your environment, for example. Now, I recently had a conversation with an IMG, and when she said to me, I know of IMG friendly clinics, I know of IMG friendly medical practitioners who are offering observership or are offering shadowing opportunities. If you don't know how to make these approaches, feel free, send us this information and we will be that bridge for you. Use the newcomer unemployment agencies. They will provide that employment support as well if it is that you need employment support to gain employment with some of these organizations that you want us to connect you with. We will be happy to connect you with those programs. You have info sessions like these from time to time. Attend these sessions, engage as much as possible. Focus on one career cluster, and as much as possible, see how you can penetrate or navigate the space that you are focusing on. Tailor your resume for those conversations that you may be having. Network intentionally as well. So everything is quite transactional. We don't like to speak of it as being transactional, but it is the reality. It is the hard, cold truth of the matter. And so network intentionally. When you're reaching out to persons on LinkedIn, connect for a purpose. Show up, okay, for those invitations that you have. Seek training linked roles as well. So if it is that you're looking at roles that you want to get into, you may have certain skills that prepare you already or certain transferable skills that prepare you for this role. If training is also included in the role, then you're a very strong candidate for this role. If the role also integrates you physically into the healthcare system, for example, it offers bridging, that is the ideal program for you to engage in. Consider those rural opportunities, and I cannot overemphasize this one. Some of the top mistakes that we will find or IEHP made is not immersing enough culturally and linguistically. They look at just the clinical licensed roles and not understanding the other non-licensed roles that are out there. You have a generic resume. And I see this from time to time, persons with this 5-page long resume applying for a job, and they use the one resume to apply for the same, for multiple jobs. You're killing your job search process by doing that. Waiting for licensure before working, you do not need to do that. It's a very common mistake. Start integrating into the system today. Leverage the community-based agencies that are out there. If you don't do that, then what happens is that you find yourself alone, feeling isolated, you become discouraged, and the process becomes harder for you. And so just think about shifting the whole mindset, understanding that you belong in the healthcare system. The alternative roles are out there. So just start now. Do not wait until tomorrow to start. Choose a specific career cluster that you want to focus on, apply strategically, engage with us, engage with the community-based organizations that you have access to, and just know that your journey starts today. Thank you. All right, so here on screen you have the QR code to connect with us as an organization. Feel free, if there is something of interest that I spoke about here today, you want to talk about it further, I will be happy to have conversation with you. You can just go ahead and scan this QR code, take a screenshot of it, and fill the form, and I will reach out to you after. Thank you very much.